So I'm Shaun Dawson. I'm playing the role of a student nurse today. My patient here will be receiving a head-to-toe assessment by me. All right. Knock, knock.
Come in.
All right. So I'm Shaun Dawson. I'm your student nurse. I'm here to perform a head-to-toe assessment of you. Before we get started, can I get your name and date of birth, please?
Sylvia Dawson, June 30th, 85.
All right. Can I check that against your wristband? All right. Cool. Thank you. And before we continue, do you have any allergies?
No, sir, I don't.
That works. So, what I'm going to be doing for you today, like I said, it's a head-to-toe assessment. It's real simple. Just going to assess your skin, your muscles, your eyes, your vision, your lungs. Make sure you're healthy, top to bottom.
Okay, sounds good.
All right. So, upon entering the room, I noticed the patient is put together, appears clean, healthy, and of sound mind. I do not see any IVs. I don't see anything that indicates an ongoing therapy. All right. So I got a few questions for you. Can you tell me who the President of the United States is?
Donald Trump.
All right, that works. And what about the day of the week?
It's Saturday.
All right. Do you know where you are?
I'm at the clinic.
And for what reason?
I'm getting a head-to-toe assessment.
All right. So this tells me the patient is alert and oriented ×4 and has an obvious ability to communicate well. Are you by chance suffering any pain today?
I'm not.
All right, cool, that works. And do you need any water? Do you have to go to the bathroom before we get this going?
No, sir.
All right, I'll slide the curtain for some privacy, and I'll do hand hygiene. So to get this ball rolling, I will start with the inspection of the head and face. I'll be looking for any masses, bumps, lesions, anything abnormal. I do not see anything like that. I will then pick up with the assessment of cranial nerve number 7. Can you wrinkle your forehead for me? Good. Close your eyes real tight. Good. Smile for me. Puff your cheeks out. All right, good. So that tells me cranial nerve number 7 is good to go, working as it should. Now I will start at the back of the scalp and I will palpate, feeling for any masses, bumps, lesions, even distribution of the hair. I will carry on with the forehead, down the face. Do you have any tenderness while I was doing that?
No.
No? Alright, that works. I will also check your frontal sinuses. Any pain?
No.
No? Maxillary sinuses, any pain?
No.
No? Alright. And last but not least, I will palpate your temporal pulse. Good and strong. Works for me. Alright. So, next up I will be performing an inspection of the eyes. I will start with the eyebrows, checking for even distribution of hair. Can you close your eyes for me? Next up will be the eyelids. I don't see any lesions, anything like that. I will be checking next the eyelashes. I see even distribution of hair. The sclera for both eyes are even and symmetrical, and they're white as they should be. I see no lesions. And last up, I'll check the conjunctiva. I'm going to go ahead and touch your face. Is that okay? All right. Pink and moist. Pink and moist is what we want. Next up, I will be assessing the optic nerve, which is cranial nerve number 2. This allows for the patient to see, and I will check that by having the patient read the paper.
Thank you for being here.
All right. This tells me near vision is functional, in that cranial nerve number 2 is good to go. Up next, I will be checking the 6 cardinal fields of gaze. This utilizes cranial nerves 3, 4, and 6. Right. Can you follow my pen for me? All right. Function of those nerves are good to go. Next, I will be checking the pupils for equal, ensuring that they're equal they accommodate, that they react to light and accommodate well. Pupil constricts. Pupil constricts. Follow my pen again. Alright. As the pen approached the patient's face, the pupils constricted. As the pen left the face, they dilated. Alright, up next I will be palpating the eyelids, the lacrimal ducts for any pain, tenderness, discharge, anything of that nature. Any pain?
No.
No? Alright. Next up we have the ears. I will be inspecting the external ear and auditory canal. I do not see any masses, bumps, or lesions on this side. No masses, bumps, or lesions on this side. When you look at me, they are even and positioned well. I will be assessing cranial nerve number 8, which is the auditory nerve. Do you hear that?
Yes.
Do you hear that?
Yes.
Alright. And last, I'll be palpating the external ear for any mass, bumps, lesions. Do you have any pain while I'm doing that?
No.
Alright. Any pain?
No.
Alright. Next up, I will be inspecting the nose inside and out. I will be checking for size, shape, and symmetry, masses, bumps, lesions, anything like that. Go ahead and tilt your head up for me. I see no foreign bodies. Nostrils are wide open. That is good. And last, I will go ahead and check the septum for any deviation or pain. Any pain while I do that?
No.
No? Alright. Next up, I will be assessing the mouth and oropharynx. Before we get started, can I ask you if all your teeth are your teeth?
Yes, they are. I have no
Alright,
dentures.
cool. Alright, can I get you to open your mouth? Alright. I see good color, pink, moist. I don't see any caries, anything like that. So I should have, while we were there, go ahead and say ah. Alright. The uvula drop just indicates that cranial nerve number 10 is good to go. And can you go ahead and stick your tongue out for me? Alright, side to side. Alright. This tells me cranial nerve number 12, the hypoglossal nerve, is good to go. Alright, so next up, we're going to be checking the neck. Appears to be in good position, not lopsided, willy-nilly. Alright, can I have you touch your left ear to your shoulder? And the other. Alright, bring your head down to your chest and look up it. Alright, this tells me range of motion is good. Next up, I'll be checking out cranial nerve 11, which is the spinal accessory nerve. Can you go ahead and push against my hands? Alright. Patient was able to resist my hands and raise them, tells me cranial nerve 11 is good to go. Next up, I'll be checking the trachea for alignment. Go ahead and lift your head up, or your chin up, please. Any tenderness while I'm doing this?
No.
No. And while I'm here, I'll be checking the lymph nodes. None of them are palpable. Any pain while I did that?
No.
No? Alright. Go ahead and tilt your head to the left and turn a little bit. Alright, no jugular vein distension on this side. Can you please turn your head to the right and lean it over? Alright, no jugular vein distension. And last, I will go ahead and auscultate the carotid artery. I would clean this off, but I will make sure it's warm. Alright. Okay. Alright. I heard nothing alarming, so it tells me we're good to go. Alright, and for this portion I'm going to move on with the inspection of the upper extremities. I'm going to be looking at the patient, assessing for symmetry of the arms, muscle size and whatnot. I will begin at the top of the first limb. I'm going to be checking for any mass bumps, lesions, any pain. And while I'm here, I will assess the brachial pulse. And as I move on down, I'm going to be checking for temperature of the skin, moisture, and whatnot. Since I'm here, I will get the radial pulse, then the ulnar pulse. Strong, not thready, feels good. The hand appears to be clean, whatnot. I don't see any deformities, no clubbing, anything like that. Capillary refill looks good within 3 seconds. I'll be checking for skin turgor. Falls down within 3 seconds, and this indicates proper hydration. If this was an elderly patient, I would perform this in the clavicle area. I will move on to the other side. Any pain? No?
No.
Alright. Like before, brachial pulse, radial pulse, ulnar. Hand once again appears to be clean. Nails, they look clean. I don't see any deformities, anything like clubbing or whatnot. Capillary refill within 3 seconds, just like the other side. At this point, I'm going to check for the patient's muscle strength. Go ahead and grab my hands. Give me a squeeze. All right. Grip strength is good and equal. Grab my hands again. Can you please pull? All right. This is good flexion. Equal strength on both sides of the hands, or both limbs. Equal strength. Go ahead and push against my hands. All right. This is extension. Again, it was balanced and symmetrical. All right. Alright, moving on, I will be inspecting the anterior chest of Ms. Dawson here. I will be assessing the symmetry of the chest, the size of the chest, the color of the chest. I'm going to make sure it's not looking like a barrel or anything. Looks good to me. And next, I will be checking her respirations. Normally, I would do it for 1 whole minute. But for purposes of this video, I will just explain. I would be watching for 1 full breath cycle and counting, hoping for respirations between 12 and 20, which indicates she's good. So next, care if I touch you?
No, that's fine.
All right. Next, I'm going to palpate the skin of the chest, temperature, moisture, lesions, bumps, anything abnormal. Feeling any pain at the moment?
No.
Alright. And next, I will auscultate the lung sounds starting at the apex and working my way to the base, alternating sides bilaterally. I'm going to ask you every time I place my stethoscope for you to take a deep breath. And then I will move on to the next spot once that breath is done.
Okay.
I don't hear any adventitious sounds. Lungs sound clear. I'm good to go. Next, I will be auscultating through the heart sounds, starting at the apex and working my way to the base, utilizing the acronym APE to man, starting with the aortic sound, moving over to the pulmonary sound, down to Ehr's point, then to the tricuspid valve, and the mitral valve at the bottom. First, I'm going to find the suprasternal notch. I'm going to move down, find the angle of Lewis. Then, once I'm at that point, I'll go to her right, and that should land me in the second intercostal space, which is where my first heart sound will be. And then I will move over to the second intercostal space on the patient's left, and this will be the pulmonic. This is Ehr's point. This will be the third intercostal space. And then in order to keep my job, I will utilize the back of my hand to lift the breast. Okay. And at that point, that would be the apical pulse, also known as PMI, point of maximal impulse. At that point in time, I would assess for pulse rate. I would take, if I wanted to locate, if there was a pulse deficit, which would be the difference between the apical pulse and the peripheral pulse, that could indicate that the patient has atrial fibrillation. And before I move on to the posterior chest, I'm going to clarify that the tricuspid valve for the anterior portion of the chest is located, the tricuspid heart sound is located at the fourth intercostal space, and I would auscultate for it there. All right, moving on to the posterior chest, I'm going to ask the patient to spin around. And I am going to be assessing the back for symmetry, making sure nothing's out of place and whatnot. I would ensure that the spine is straight. Could you lean forward for me, please? And the way it appears right now, everything is in line. All right. And moving on, I will then palpate the back, checking for tender spots, bumps, lesions, temperature of the skin, moisture, and so forth. Any pain?
No.
All right. Okay. Now, I'm also, while I'm back there, I'm going to be palpating the scapular region, checking for symmetry and proper alignment and whatnot. Okay. And while I was palpating the back along the spine, I was feeling for proper placement of the vertebrae throughout the spine. Now, I'll bust out the stethoscope and auscultate from the apex to the base of the lung, alternating sides, ensuring I listen for sounds bilaterally. When my stethoscope lands, I want you to take a deep breath, full in and out, all right? also going to auscultate the lateral of the posterior chest. Breathing is clear, no adventitious sounds. All right. Moving on, I'll be performing an inspection of Miss Dawson's abdomen. I will inspect first. I'll move on to auscultation and finish up with palpations. I'm inspecting size, shape, symmetry, chrysalis, bumps, mounds, anything abnormal. And then, with my stethoscope, I will auscultate through the 4 quadrants of the abdomen. I hear it. And in this event, I did hear bowel sounds, so that's good. If there was not bowel sounds present for 5 minutes, I would annotate that and run it up. We can get further investigations going on that. At this point, since I have auscultated, I will now palpate. Any pain?
No.
Still no pain?
No.
Okay. Now, for purposes of this video, I'll explain how I would palpate the inguinal region. Going through, I would be feeling for lymph nodes that I could palpate. If I cannot palpate them, that's a good sign. While I'm there, excuse me. Sorry. I would palpate the femoral pulse using both of my hands on either side of the pulse site. All right. And next up, I will be doing the lower extremities of the lower extremity portion of the head to toe for Miss Dawson here. I'm going to start by inspecting the legs for size, shape, symmetry. Any bumps, lesions, anything abnormal. Could I ask you to lift the bottom of your pant legs? I see no edema. That's what we want. Next, I'm going to be checking. You can drop them. Next, I'm going to be checking for muscle strength and equality of that muscle strength. Can you raise your legs for me? All right. Can you pull against my hands? Thank you. All right. Can I get you to raise one foot up, bring your toe up, bring it down? All right. And that was assessing dorsiflexion and plantar flexion. All right. Next up, I will palpate each leg, assessing for the usual bumps, lesions, anything abnormal. Any pain?
No.
All right. What about now?
No.
All right. And while I'm here, I'm going to check each foot for capillary refill. All right, and color came back within 3 seconds. And again, color came back in 3 seconds, so that's good. All right, and now I'm going to finish up with the remaining pulse sites. Popliteal, which is behind the knee. And then dorsalis pedis, top of the foot. Posterior tibialis on the inside of the foot. Once again, popliteal, dorsalis pedis, and then posterior tibialis. Thank you. All right. And to finish this head to toe assessment up, I'm going to end with assessing Miss Dawson's neuro function, neurological function. Thank you very much. All right, may I ask you to stand up? All right, I'm going to have you walk forward, and then you're going to turn around, stand there. I'm going to pass through, and then you're going to walk back to the chair.
Okay.
All right? All right, go ahead. Okay, and back. All right. Gait looks fine. She's not stumbling, swaying side to side or anything like that. At this point, can I have you bring your feet together, stand still, and close your eyes? And by the way, this is the wrong birth test. All right. She's going to do this for 5 seconds. I do not see any swaying. This indicates that there is not a positive. All right, go ahead and open your eyes. All right. Now, for this portion, I'm going to have you close your eyes. Then you're going to bring index finger to your nose, and then the next one. And you're going to do this while your eyes are closed, and you're going to do this 3 times each side, please. All right, and that looked good to me. So cerebellar function is as it should be. And in closing, do you have any questions of me?
I do not.
Do you need anything of me?
No, I'm fine. Thank you.
I think I said the same thing twice, but that's okay. All right. So hand hygiene, and thank you for your time, and everything went well.
Thank you.